I'm Susan Kim from the Idaho Immunization Coalition, and the topic of this talk is evidence-based immunization best practices. Why do we care about this topic? We care because vaccines work. This is data from the Centers for Disease Control that looks at vaccine burden in the pre-vaccine and post-vaccine era for different vaccine-preventable diseases. The column on the left shows the pre-vaccine disease burden morbidity in the United States for these different vaccine-preventable diseases. The middle column shows the post-vaccine incidence, and then the column to the right shows the reduction in disease burden for these different vaccine-preventable diseases. And as you can see, we've had remarkable success in decreasing disease burden. This is data from a 2005 study that looked at the economic burden of vaccine-preventable diseases. At the time, there were 7 different routine childhood vaccinations given in the United States. For every birth cohort, so for every group of children born in the United States during a given year, those 7 different vaccines prevented 33,000 deaths and 14 million cases of disease, saved $10 billion in direct medical costs, and an additional $33 billion in indirect costs, including disability and lost productivity. Well, how are we doing in Idaho with our immunization rates? This is 2010 data from the National Immunization Survey. That's a survey performed by the Centers for Disease Control. For our routine 431-3314 vaccine series, we placed last in the nation. So the national average was about 70%, and Idaho was about 57%. We do have recent 2011 data, which pulled us out of the cellar. For the same group of children, our immunization rate has now increased to 67%, which is up almost 10% from the 2010 data. Well, how can we improve these immunization rates? The Community Preventative Services Task Force have done an extensive literature search to look at what modalities have been proven to actually improve immunization rates. They've categorized these into 3 different groups. The first is expanding access, and the modalities that seem to improve immunization rates under the category of expanding access include home visits. The requirement is that they will at least discuss vaccines, look at the child's vaccine records, and recommend the vaccines to the child and their parents. And this seems to increase rates by about 10%. Another category under expanding access is reducing out-of-pocket expenses, and that seems to have quite a significant effect on improving immunization rates. Next is providing vaccine programs in schools or child care centers, and that increased rates by almost 50%. And then last in this category is having vaccination programs through WIC visits. And again, just like the home visits, the vaccine itself did not have to be administered, but just discussing the vaccines definitely had a positive impact on immunization rates. The next category provided by the Community Preventative Services Task Force is increasing community demand. And the 3 different areas where we can have an effect are having client or family incentives, providing some kind of reward for the family to have the vaccines performed or to have their immunizations up to date. Second is having a client reminder recall system, so letting the clients know, the patient and their family know that they are due or overdue for vaccines, and that seemed to increase rates by about 6%. And what really had the biggest effect under this category was having vaccine requirements for school or child care entry, and that increased vaccine rates by about 35%. The next category was provider-based interventions, and there are 4 different modalities under this category that seem to provide increased benefit for immunization rates. The first is an immunization system, kind of like the IRIS system that we have available here in Idaho, which has a central repository for immunization information, as well as the ability to give reminder recall to the clients. And that seemed to increase immunization rates by about 14%. Next is giving providers feedback on how they are doing with their immunization rates in their clinics. Provider reminders, so reminding providers when their patients are due for vaccinations. And then last is standing orders, and standing orders had an almost 20% increase in immunization rates. and that is allowing patients to come into the office without being seen by the provider, yet still receive vaccinations. The American Academy of Pediatrics also has a number of recommendations to improve immunization rates. The first is to make the vaccine readily available. This includes having vaccine-only clinics, immunizing at all visits, increasing access to vaccines during peak demand, so for example, during flu season or before school starts, vaccinating siblings even if they do not have an appointment, and then using non-traditional sites for vaccination, so sites outside of the medical home. The next American Academy of Pediatric recommendation is to coordinate with other healthcare services so that there is good communication between the medical home and other sites that might be providing vaccination. Next is decreasing barriers to vaccines, and this would include delays in scheduling appointments, delays in the waiting room, requiring a well child visit before providing vaccines for patients, having standing orders available for nurses to give the vaccines without the provider needing to see the patient, and then also having vaccine-only appointments. The AAP also recommends decreasing the cost of the vaccine, reviewing vaccination status at every visit for every patient, and following only medically accepted contraindications. These slides show the medically accepted contraindications, and they should be available in your packet. The American Academy of Pediatrics also recommends having culturally appropriate and easy to understand risk-benefit discussion for all vaccines that are recommended. They recommend following correct procedures for storage and handling, and having accessible, up-to-date written vaccination protocols that deal with storage and handling, vaccine schedules, and reporting adverse events. They also recommend having all personnel who administer or manage vaccines in the office to have ongoing education, continuing education on vaccine protocols. It is recommended to administer as many vaccines as possible at each visit, and to report adverse events through the vaccine adverse event reporting system. So as discussion points, what best practices that we have talked about today do you currently use in your office? Which best practices do you plan to try to implement? And then what steps will you take to begin the implementation process?
This concludes this particular learning session. This would be a great time to work with your practice team and identify some areas to focus on and make changes for the future. Thank you.